Hi, everyone. Thank you for joining us today. I'm Jocelyn Bogdan, Program and Policy Specialist at Consumer Voice, and I'll be joined later by Sam Brooks and Lori Smetanka. This afternoon, we're actually pretty excited to discuss the latest CMS visitation guidance updates with you. But first, I just want to go over a few quick housekeeping tips. First, we want to let everyone know that this webinar is being recorded and it will be available to everyone, both on our webpage and via email for anyone who registered. The slides will also be available on our webpage and will be emailed to everyone who registered for the webinar. We also are going to be answering questions at the end, and we want to encourage everyone to make sure that you put your questions in the Q&A box. And if you want to chat with each other or make any comments, you keep those in the chat box because we'll be checking the Q&A box at the end to pull questions. And that's all the housekeeping we have. So next slide. So starting in March of 2020, CMS began issuing guidance that severely restricted and frankly completely shut down visitation in nursing homes. As the pandemic progressed, they updated the guidance slowly, allowing visitation in certain situations, and then updated it again, allowing a little more visitation. But each time they did this, they left an enormous amount of facility discretion. And we know that residents suffered immensely. They suffered physically from neglect and poor care, and they suffered emotionally from the incredible isolation that they endured. And we know that families suffered too, unable to see mothers, fathers, siblings, friends, and children. At Consumer Voice, we have been strongly advocating for a full restoration of residents' rights to visitation for months. Because enough is enough. We sent out a letter to CMS with other advocacy groups in June asking them to restore this right. And last week on November 12th, CMS issued updated guidance that comes pretty close. They acknowledge the suffering that residents have endured, and they acknowledge the different world we're now living in with such high levels of vaccinated residents and new rules requiring staff vaccinations. As a result, this new guidance allows visitation for all residents at all times. This is huge. We know with the holidays rapidly approaching, it's important that everyone understand this new guidance and be able to articulate the rights that residents have when it comes to seeing their families and friends. And that's why we're having this webinar today and also releasing a summary of the new guidance. We strongly urge, and we urge it so strongly that I am likely to mention it again throughout this webinar, that if you are a family member or an ombudsman, you print out this guidance and take it with you to your facility. Having the guidance with you enables you to show the facility exactly what CMS has said in regards to visitation, that residents are allowed to have visitors at all times and that facilities cannot arbitrarily restrict visitation. In fact, they really can't restrict visitation at all. So after this webinar, print out the guidance, or if you don't have a printer, pull it up on your phone and keep it with you. We're going to go over the main points of the guidance and then some additional points. But as you can see on this slide, the most important takeaways are that you can visit your loved one at all times and they are able to leave the facility at all times. This last part has always been true, but we know it has really been a struggle for people. Next slide. So the main takeaways, again, facilities must allow indoor visitation at all times for all residents. And what this means is they cannot tell you that you can only visit between 12 and 2 or during working hours. Residents are allowed to have visitors when they want them. And facilities cannot limit the frequency of visitation, the length of the visits, the number of visitors, and this is really important. They can't require appointments for visitation anymore. You don't need to pre-schedule a visit. You can come to the facility when you want or when the resident wants you. Now, it's also important, we're still living through a pandemic and residents are still a very vulnerable population. So everyone needs to follow all COVID-19 infection prevention protocols. Your visits cannot increase the risks of COVID to other residents. In line with that, visitors should be screened before entering to ensure that they don't have COVID. Now, this is different than a testing or vaccine requirement, and we're going to come back to that later. But if the facility knows you've tested positive for COVID, you will not be allowed in, and you will not be allowed in if you have symptoms of COVID-19. Next slide. A few more big picture changes. First, vaccinated and unvaccinated residents can have close contact, including touch. Now, this has been true for vaccinated residents for months, but now it's true for everyone. Unless there be any confusion about it, the guidance states clearly, and this is in quotes, unvaccinated residents may also choose to have physical touch based on their preferences and needs. The guidance does say that visitors should be made aware of the risks, but that's it. It can happen. And if the facility pushes back, this is where it's great to have that guidance with you so you can point it out. It's right there in the middle of page 5. Communal activities and communal dining should also be happening. We know there are residents who have reported that their facilities were still not conducting any activities or dining as recently as the summer, and there is just no reason for that at this point. The guidance allows for both of these things, but it does go on to say that the safest approach is for everyone to wear masks in communal areas. And the last big point before we get into more specifics is that while CMS strongly encourages vaccinations, and they do, and while consumer voice also strongly encourages everyone to be vaccinated, nursing homes cannot turn away visitors, ombudsmen, protection and advocacy representatives, or surveyors based on vaccine status. So we're going to come back to that in a few minutes. Next slide. So those are some of the biggest main points that we want to make sure everyone walks away with today. But we also want to make sure you really have an understanding of this full guidance. So I just want to walk you through a few different topic areas. Next slide. Masking. So this part of the guidance is a little confusing, but this is the main point. If the resident and the visitor are both fully vaccinated and the resident is not immunocompromised, they can decide if they want to wear masks and have physical contact. Now, if COVID-19 rates are high in the community, if they're substantial to high, the guidance strongly encourages residents and visitors to wear masks. It says that they should wear face coverings or masks. And even when the community rates are lower, the guidance states that it's always safest to mask and distance, especially if the resident or the visitor is not vaccinated or if the resident is high risk. But the takeaway here is if the resident and their visitors are all fully vaccinated and are not immunocompromised, they can choose to take off their masks with each other. It also notes that visitors should always wear their masks around any other staff, any other residents, basically around anyone except for the person that they are visiting. Next slide. So where can visitation happen? In previous guidance, a lot of visitation was put outside of the residents' rooms, and we know that this was hard for residents and their families. The residents' room is their home, and for family not to be able to visit there, for loved ones not to be able to look around and make sure things were in place, that pictures were on the walls, we know that it's been very hard. So now the guidance states that visitation can occur in the resident's room, and in many places, it actually suggests that's where it should be occurring. It also does allow for designated visitation areas. And it also still says that visitors should not be wandering around the facility, that they should go straight to the resident's room or to the other designated space. Now, what if the resident has a roommate? If they have a roommate who isn't vaccinated or who is immunocompromised, then this is a time where visitation really still shouldn't be occurring in the resident's room. If at all possible, it should take place elsewhere with respect to their roommate. If the resident can't leave their room for health reasons, then the facility really needs to work to find a way to allow this in-room visitation while also adhering to COVID-19 infection prevention protocols to ensure that the roommate also stays safe. We do anticipate that this is going to be an area where there is some uncertainty. We've already heard some questions about it. If you want to have visitation in your room and your roommate doesn't, there are likely going to be issues, and off the bat, we want to encourage people to try to work with the facility and your roommate. Maybe you can visit when your roommate is at lunch or an activity, or come to the room for a few minutes and move to a designated space. These are situations that are likely going to be very situation specific. But the good news here is that families should be able to come back into their loved ones' rooms, and that's huge. Next slide. So this is another big change with quarantine and transmission-based precautions, which is basically a step below quarantine. Residents who are in these situations, so if they have suspected COVID-19 or if they're quarantined for other reasons, they can still have indoor visitation. And these visits should occur in the resident's room, and the resident should have masks on. Also, visitors should be made aware of the situation before visiting so they understand the risks and the precautions that are necessary. And I want to add here that these visits are actually not recommended. The guidance says that, but it also says that they are allowed. So this is a huge change from previous guidance. The guidance clearly states these visits can happen now. Next slide. So outbreak situations. We know that particularly recently over the summer and this fall, this is the reason that a lot of visitation has been shut down. There have been positive cases, sometimes just one, and facilities have shut their doors. I want to read the exact language from the guidance here. So this is in quotes. While it is safer for visitors not to enter facilities during an outbreak situation, visitors must still be allowed in the facility. You cannot get clearer than that. Even in an outbreak investigation, you must be allowed in. So this is a huge change, and hopefully this really makes a difference in the lives of residents and families, because facilities cannot keep you out based on outbreaks or positive cases. You must be allowed in. Now, if this is the situation, then all visitors should mask regardless of their vaccination status during the visit. And these visits should again happen, if at all possible, in the residents' rooms. And again, this is a time when visitors need to be made aware of the situation beforehand so they know what precautions they need to take and they can make decisions based on the situation. Next slide. Testing and vaccination. So facilities are encouraged to offer testing. And if they don't offer testing, then they should be encouraging visitors to get tested before they come in. But visitors are not required to be tested before entering a facility. And as we noted before, while CMS strongly encourages all visitors to be vaccinated, and to be clear, so does Consumer Voice, facilities cannot require vaccinations to enter facilities. If you're entering a facility with a population of vulnerable residents during a pandemic, of course, it is better to be vaccinated. But this is not a reason that facilities can deny visitation. And again, this includes visitors, ombudsman, P&A system representatives, and surveyors. Next slide. Next slide. And while talking about the ombudsman and P&A system representatives, nursing homes must provide them with immediate access to any resident. If a resident is in quarantine or on transmission-based precautions, or if they're unvaccinated in a county with a high level of community spread, then everyone should be made aware of the risk of visiting, and the visitation should happen in the resident's room. Also, facilities must continue to allow alternative communication if that's what the resident chooses. And of course, facilities must continue to comply with federal disability rights law. Next slide. So in terms of the entry of healthcare workers, and this is mostly the same, but we just want to review it because it's been a while. Healthcare workers must be allowed into facilities as long as they're not showing signs of COVID or subject to a work exclusion. And this includes anyone coming in to assist a resident with a transition back to the community. And EMS workers do not have to be screened before entering. Assumedly, an EMS worker is coming in because there's an emergency situation, so there's an exception in those circumstances. Next slide. Okay, hold on a second, everyone. The slides aren't moving, so we're just gonna hold on 1 minute.
Jocelyn, maybe you can keep talking and Libby can try to catch up. Libby, can you maybe take them down and share again?
Sure. So our last category is a really important one. And this is about leaving the facility. So to be very clear, and I said this earlier, residents have always been allowed to leave their facilities. What happens upon their return has changed, but residents are just like anyone else. They can leave their homes if they want to. We know this is really important to everyone in light of the upcoming holidays. Residents can leave the facility when they choose. When they come back, they should be screened for signs or symptoms of COVID-19. Now, if they or a family member reports that they've had a close contact with someone with COVID-19, then the resident should be tested regardless of whether or not they're vaccinated. If they are not vaccinated and there's a reported close contact, then they should be placed in quarantine. Now, again, this is only if they've had a close contact with someone who is positive. Alternatively, if they come back and start developing signs or symptoms upon returning to the facility, they should be placed on transmission-based precautions regardless of their vaccination status. And if the resident leaves frequently or leaves for a prolonged time, more than 24 hours, unvaccinated residents can be tested even if they're not showing signs or symptoms of COVID-19. Facilities can also consider quarantining unvaccinated residents who leave the facility if it's not clear if they followed infection prevention practices or if it's not clear if those around them did. Now, that still seems to give a lot of discretion, but again, that is for unvaccinated residents. When this guidance was written on November 12th, it noted that 86% of residents were fully vaccinated. So for most residents, they will be able to come and go without many of these concerns. Unless they've had close contact with a positive person or they're showing signs of COVID-19, they can come and go and everything will be fine. Now, residents should still be monitored upon return, and residents who leave for 24 hours or longer can be treated as a new or readmission as recommended by CDC guidance. So again, this is where we see a big difference between someone who's vaccinated and unvaccinated. In our summary of the guidance and in the guidance itself, it links to the CDC information. And what it says is that if a resident is unvaccinated, then as a new admission or readmission, they should be placed on a 14-day quarantine, even if they've had a negative test. Now, it does allow that if community transmission is low, the facility can elect not to do this based on their own risk assessment, but it is clear that this can't happen for residents who are vaccinated or residents who are within 90 days of a COVID-19 infection. So the lesson here is, if you are vaccinated, you can come and go from your facility without too much concern, and that's great. That's a great change. Next slide. Oh, sorry. Overall at Consumer Voice, we're actually really happy with this new guidance. It goes much further than previous guidance, and hopefully this really will become the full restoration of residents' right to visitation that residents deserve. But we have all lived through these past 20 months, and we know better than to assume this is going to unfold without any issues. As this webinar has been going on, I've seen some people putting issues they've already had in the chat and Q&A box. And so, what should you do if your facility continues to deny visitation? First, and I know you hear this from us a lot, but we are just going to keep saying it, contact your long-term care ombudsman program. This is what they are there for, to advocate for residents of long-term care. They can help you advocate for the visitation you deserve, and you can find their contact information on our website. Also, please file a complaint with your state survey agency. If your rights aren't being met, you should file a complaint so that it can be investigated, and denial of visitation should absolutely be investigated. You can find the information for that on our website as well, and you can also ask your ombudsman to help you with this. You should also reach out to leaders in your state. They need to know what's going on, so we strongly encourage you to contact your state legislators and local representatives and tell them what's happening if your visitation rights are being denied. And keep at it. If you don't get a call back, call again. Sometimes advocacy takes a lot of work and it's not fair, but it's the reality. Sometimes one phone call isn't enough. The guidance is very clear now. These are your rights and they should be enforced. We also wanted to let everyone know that CMS and the CDC are holding a National Nursing Home Stakeholders Call on Tuesday, November 23rd at 2 p.m. Eastern Time. When we mail out the slides, you will see a link to register for that. It is a great opportunity to hear about the guidance directly from the horse's mouth, so to speak, and to ask them questions. And with that, I think I have talked enough today. So I'm going to turn things over to Sam Brooks, who is going to go over a few important advocacy items and then take questions. Sam?
Thanks, Jocelyn. That was really informative. And look, we see a lot of questions, and don't worry, folks, we will get to them. We're having some technical difficulties right now with the slides, so you won't be able to see what I'm talking about. Nevertheless, there are links to them in the chat where you can download it. We wanted, while you're all here, and we have advocates and family members and even residents here, we wanted to bring to your attention an issue that's going on right now in Congress, an important issue and an important opportunity right now to have some meaningful reform passed in the United States Congress. As many of you are aware, they're currently, the House and the Senate are going through the budget reconciliation process. As part of that process, the House has introduced a bill that includes 5 very important nursing home provisions that we are hoping will get passed. Oh, here we go. So these are drawn from a bill called the Nursing Home Improvement and Accountability Act. And they would be probably, if these were passed, would be probably the most significant increase of protections and reforms for nursing home residents really in decades. Consumer Voice and other advocates have been burning the candle at both ends, really trying to make sure that these are included in the final package. However, it's going to be a long struggle. Just to talk a little bit about the provisions, one of the provisions would require that the nursing home have an RN on staff 24 hours a day. Believe it or not, federal regulations only require a RN to be present 8 hours a day, which is to us absurd and really causes significant problems for residents. This, if passed, facilities would be required to have one 24 hours per day. It would also require the Centers for Medicare and Medicaid Services to conduct a study on minimum staffing standards and promulgate regulations. As many of you are likely aware, there is no federal minimum staffing standard. Although we've been pushing for one for years, there just is not a standard. Some states do have them, but not the federal government. This would result in, if this was passed, it would result in a minimum staffing standard being promulgated, not for several years, but it would be promulgated. It would another provision would increase enforcement and oversight of nursing homes, which we know is, just from looking at your comments and your questions, we know that is something that's very lacking, the failure of state agencies to enforce the regulations. Increased scrutiny on data submitted by nursing homes to the federal government. So this would require more auditing, more for accuracy of certain data that is submitted, MDS data, staffing data that is submitted by nursing homes to the federal government, particularly CMS, and require auditing of Medicare cost reports. Nursing homes receive billions upon billions of dollars each year from taxpayers. Yet their constant refrain is that we don't have enough money. These cost reports are something that they're required to file every year, but essentially no one looks at them. This would require them to be audited, to be a certain percentage to be looked at, and for accuracy and for potential discrepancies. So those are the provisions. Next slide, please. Uh-oh. We might be having a slide problem here again. Can we go to the next slide? Thank you. However, the nursing home industry is lobbying aggressively to have the staffing provisions removed. I suspect they would like to have all of these provisions removed, but they are pulling out all the stops in an effort to get Congress Congress to remove these staffing standards, and we're very concerned. They have deep pockets and they have significant influence, we're concerned that they may have these removed. Currently, they are in the House version of the bill, those provisions. However, the Senate doesn't have a version yet, and we're not sure when that will be. And none of these provisions could make it into the Senate version, and that's what we're extremely concerned about. That's why Congress needs to hear from you. Nursing homes are having their staff, their administrators and staff call their local district offices and saying that have these provisions removed. We can't provide enough, we can't have an RN, we can't provide enough care, and we all know that that's not true. So we have issued an action alert today. Many of you have probably received many action alerts from us recently as we try to push this legislation through. But this most recent one is trying to get folks to call their local district offices, their Congress members' district offices, both the House and the Senate. So if I think we put the link in the chat, I hope. I will put it in again. You can click on this and you can go and it will give you instructions on how to find out who your Congress members are and how to contact them and even what to say. We know that it's an uphill battle, but we're fighting for nursing home residents here. So let's not say we can't do anything. We owe it to nursing home residents. So thanks. That's all I have.
Great, and I'm just going to jump back on for a second to let you guys know we have a couple resources. We have the updated nursing home guidance where you can just go to CMS. And again, this is the guidance that I strongly urge you to print out and take with you. And then below that, you will see a link to Consumer Voice's new summary of this guidance, which we are just releasing today. And it basically goes through the guidance and breaks it down for you. And with that, we are going to start taking questions.
We have a lot of them. I think one of the most repetitive questions and really probably frustrating questions for folks is facilities saying, well, we see the CMS guidance, but we're not going to do anything until either our county or the state health department issues their own guidance. And what do you do in that situation? I'm happy to answer that. Jocelyn, you can as well. This is federal guidance. This is issued by Centers for Medicare and Medicaid Services, who is the primary overseer of nursing homes. Therefore, it trumps other guidance that is out there. It takes precedent over local and state guidance. It must be followed by nursing homes. We know it's frustrating. We know there's been a lack of enforcement around visitation and that nursing homes often ignore it and say, well, we're not going to do anything. And what you need to do in those instances is file a complaint again with a survey agency. You can also, we will also be collecting stories and trying to figure out what states are having the hardest problems with this so we can let CMS know. But CMS will need to step up and do some enforcement around this for this to work. And we're confident that they will. They have really issued some good guidance here. It's going to take time. It was only issued last week. Hopefully facilities will start to follow it. But you also have a very good opportunity next week to go and listen to CMS and to ask these questions, see these questions asked, because a lot of people are going to have these questions. And to get it from the horse's mouth that this is controlling is very important. So we encourage you to go and attend that meeting next week.
Yeah, Sam, I completely agree with everything you just said. I also just want to add, and you're absolutely right, this is federal guidance. It is expected that state and local health departments will follow it. Also, throughout the guidance this time, we noticed that, when they talk about, for instance, visitation during an outbreak, because that must happen, and they talk about how facilities can make it happen, they say facilities may contact their local health authorities for guidance or direction on how to do this. So that makes it very clear. CMS is expecting everyone to get on board with this. This is the guidance moving forward, and states are expected to follow it.
I think one of the other questions that has come in a lot is who which facilities does this apply to? Remember that CMS guidance applies to nursing homes, those that are certified for Medicare and Medicaid. So assisted living facilities, boarding care homes, personal care homes, we have to rely on state rules and state guidance with respect to those. So anything that comes out from CMS, we need, that applies to nursing homes. And that's an important distinction. I know it does get frustrating, but it is an important distinction that we have to remember. Sam, can you pull up another question?
Sure. I think there's a lot of questions. I think one thing we need to reiterate is that visitation is allowed at all times, even during outbreaks. And I think people are so are so traumatized, I guess, by visitation policies for the last year that yes, there's still been a lot of questions. During an outbreak status, visitation is allowed. Okay. So some other question was, does this allow families and friends to again join residents during facility group activities?
Jocelyn, do you want to take a stab at that?
Sure. I mean, that's a great question. And, I do think that facilities, in saying that they don't have the enormous discretion that they've had throughout, they do still have the right to ensure that visits be conducted in a manner that adheres to the core principles of COVID-19 infection prevention. And so I'm not sure. I think it would really depend. I mean, they're really encouraging visitation to happen in the resident's room or in another designated area. So it doesn't really sound like, for instance, I don't think having a Thanksgiving Day event where families join residents for Thanksgiving is really what this looks like yet. Because again, we want to really still try to minimize the impact that visitation is going to have on other residents in the facilities. And so in terms of communal activities, I'm not quite sure that we're there yet. But you don't know. And in some cases, there might be small exceptions to that. It's not clear, and that might end up happening on a facility to facility basis based on how many people are visiting at any one time.
Great, thanks, Jocelyn.
Sure.
Sam, do you have another question queued up?
1 second. We're going through, there's a lot of them here. Sorry.
There were questions again about a number of questions about visiting in a resident's room versus other parts of the facility, because some are not allowing visits in the room. So Jocelyn, you had covered this during your presentation, but could you just touch on that again with what it says with respect to visiting in a resident's room versus somewhere else in the facility?
Sure. So, I mean, the guidance does say that visits should happen in the room or another designated area. So I do think there are going to be situations where facilities say you cannot visit in the room. And I think in those situations, you should be asking why. If it's a situation where there is no roommate who, if they have a roommate that is unvaccinated or who is immunocompromised, then I think the facility's going to probably win that battle. But if they don't, I think this is a time when you can talk to your ombudsman, you can talk to the facility first and just say, why can't I visit in the room? The guidance says we can visit in the room or somewhere else, but my loved one wants me coming to their room, and shouldn't that person-centered visitation, person-centered care, shouldn't that dictate that I can come to their room? So, I mean, it allows for it. So I think that is something that if you want to, you should really push for. And yeah, I don't know if anyone has anything to add to that, but.
Yeah, and I think that there need to be other options available for visiting as well in the facilities. Yes. So, it may be that it's not appropriate, or one roommate is uncomfortable having other people come into their room that if they don't know their vaccination status, or they're not familiar with the other individuals, like a roommate's family, for example. So that's something that can be worked out, certainly between the roommates and the staff. But accommodations need to be made to ensure that people have an opportunity to visit with their family members. And whether that's in the room or another part of the facility, then they need to make those accommodations. But certainly, I think that should be something that should be, certainly communicated between roommates as much as possible as well, to really get their feelings about having, people come into the rooms.
Yeah, I completely agree with that. And I do think, that's where the part of the guidance that says, your visitation shouldn't put other people at risk sort of factors in. If a roommate really feels uncomfortable, then, hopefully residents will take that into consideration. And, as I said earlier, when going through the guidance, a lot of this is going to be very situation specific. And as Lori said, the best thing you can do is really have the roommates, have the residents try to talk it out themselves and involve the staff, and have the facility try to enable what makes the most sense. There might be a time when the resident's roommate is not in the room, they're somewhere else, and that might be a good time to then visit and do that in-room visitation. At other times, maybe you meet somewhere else. But I do think that respecting each other's priorities and perspectives is going to help a lot here.
I think another point, there's been a lot of questions about what to do if the facility is not following this guidance. And so, while the guidance went into effect right away, and it's something, again, that's why we wanted to have this call today. We've summarized the guidance for you and given you information about it. You should take it to them, because in many cases, you're more informed than they are about what the guidance requires. So take copies with you of what the guidance requires. But if you're having problems with the facility that is not following the guidance on what's required, the steps that we encourage you to take are contact your long-term care ombudsman, and you can get your ombudsman's contact information on our website. We have a Get Help button, and you can find ombudsman programs all across the country there. File a complaint with your state survey agency. They are responsible for overseeing nursing homes and ensuring that they're complying with the rules and any guidance that is issued by CMS. And they are going to be the ones who are responsible for ensuring that they're following this particular guidance. And that's what CMS is going to tell you too. Did you file a complaint with the survey agency? And if you're not getting a response there, then CMS would direct you to contact the CMS regional office in your area. And we'll be posting information about CMS regional offices. We don't have that up on our website right now, but they're a next step for sharing, the issues that you're having with accessing your loved ones or getting into the facility. So those are the steps, and we know it can be frustrating. You may not get resolution the first time, but advocacy is something that you can continue to be pursuing and working with not only your facilities, but also the ombudsman and the survey agencies in order to get full implementation of this guidance. Sam, do you have another question queued up?
Sure. There are some questions about, can the facility limit the number of people in a room, or number of family members in a room during a visit?
So that's a really good question. And the guidance does say that they cannot limit the amount of visitors that you have. But again, you do still have to align with COVID-19 infection prevention protocols. So I think that might be very situation specific. Again, if there's a roommate involved and you want to bring 10 people into your room, I can see the roommate having issues with that. But then again, if it's a situation where a resident is declining and they want to have their family in there with them, then I think that should be okay at this point. So I think in some ways it's going to depend, but the important thing to remember is they cannot limit the number of visitors that you have. And so if they try to do that, that's again, whereas Lori just said again, have the guidance with you and point out that it says that.
You are still required to follow the infection prevention protocols that are in place, ensuring that you're washing your hands, for example, or using hand sanitizer. You can't be wandering around the facilities or interacting with other residents and family members. And the social distancing certainly is an issue, but you do have to follow the infection prevention protocols when you go into the facility. That is something that's really important. And again, we'll relink to those as well, so that you certainly have, we all have an obligation to ensure that we're doing everything we can to not spread the virus. While masks are not always required, and Jocelyn had talked about that a little bit, and maybe we need to touch upon that again, certainly they're encouraged. And so, inform yourselves about what the infection prevention protocols are as well, and ensure that you're following those.
Great. Yeah, there's another question about, again, this guidance does not apply to assisted living facilities, but a question about when can we expect some changes in the visitation around assisted living facilities. And to answer that question, assisted living facilities are regulated by the states. So that's really going to depend upon each individual state and the regulatory agency there that oversees nursing homes. Assisted living facilities. So that's where the pressure needs to be applied. We would hope now that nursing homes, that this guidance has come on the federal level to nursing homes, that assisted living facilities and state agencies will follow the lead of the Centers for Medicare and Medicaid Services and open up visitation again for residents. And I just want to say one other thing. These are residents' homes, and just like you and I can have visitors anytime, residents should be able to have visitors anytime. This is what it was like before, and this is what it should be like now. Many residents don't want visitors in the middle of the night, but remember, these are residents' homes, and so there is no restriction on when that visit can happen. Another question I thought we'd ask is popped up a couple of times: compassionate care visitation. Where does that fit in? Jocelyn or Lori, how does compassionate care fit in now with the resumption of a full visitation? And maybe an explanation of what that was, I guess.
Yeah. So it's, I will be honest, compassionate care is it's not really that necessary at this point, because compassionate care existed when there was a resident who was in decline physically or emotionally. When visitation was mostly shut down in facilities, compassionate care was one type of visitation that could always occur regardless. So if you were a resident who had recently lost a loved one, for example, or if you were a resident who had lost a lot of weight and was really physically declining and you needed a loved one to come in to help cue your eating, then that type of visitation was supposed to always be allowed. Now that all visitation is allowed at all times for all residents, the need for compassionate care is hopefully over. Hopefully we don't even need to really deal with that term anymore. It is addressed in the guidance, basically just to say that it continues to be allowed at all times. But it also says that, it was really there previously because there were scenarios when residents should only have those types of visits. And now residents should be having visits at all times from everyone. They do note that, there might be a very few times when, for some reason, if a resident is severely compromised and, regardless, it says that those visits continue to always be allowed, but at this time, they're really not that necessary because all visitation is always allowed. And just to go back to something, Sam, you said a minute ago about, the timing of visits and how you might not want a visitor in the middle of the night. The other day, I talked to a family member who had said that her mother's facility, had been shut down for most of the fall since August because of outbreak situations. And after this guidance came out, the facility came forward and said, we are reopening from 9 to 8 p.m. every day. And people were very happy. And I said to her, no, call your ombudsman, because that is not enough. It feels like enough. I know people have gone through such an incredibly difficult past 20 months that anything feels like enough at this point. But right now, visitation is allowed at all times. And what if you have a family member who works 9 to 8 p.m.? They still are allowed to come visit. As Sam said, you might not all residents are going to want a visitor to be coming at 10 p.m., but this is their home, and their family members, their loved ones, their friends can come whenever they want them to come. And so that's really important to remember. If you start to see facilities that have previously been shut down entirely start to allow a lot more visitation, but they're still not following the guidance, hold them accountable. They still should be following this guidance. A little bit isn't enough at this point. This guidance gives back people their right to all visitation at all times.
Right.
And I just wanted to touch on one thing. It's been popping up in the questions that facilities are saying they have 30 days to comply with the guideline. That's not true. This new guidance is effective immediately. So I'm not sure where that's coming from. If you read the guidance closely, it's clear that it was effective last week on Friday, and facilities do not have 30 days to implement and follow this guidance.
There are also, certainly as we are looking at the questions as folks are coming in, there's a lot of repeat questions, and there are a lot of questions here, so we are not going to be able to get to all of them. But I will also say that, as holidays are coming up, there still are issues with the facilities needing to ensure social distancing, and the fact that, they can't have everybody, every family member, multiple, lots of people in the facility all at the same time on the same day. It's not safe with in terms of the need for social distancing. So try to spread out the time that you want to visit with your relative, and work with the facility. They should be working with you, communicating with you. While it's certainly the guidance says that they can't require advance require you to sign up for visiting hours and things like that in the guidance. There are also issues with respect to making sure that it is a safe environment, and so we need to remember that. And so I think by really communicating with the nursing home, with your loved one in the facility, and they should be communicating with you also, and working to spread out your visits across over days, that we can ensure that everybody gets an opportunity to visit. It doesn't always necessarily have to be on whatever that main holiday is. So please try to spread out your visits as well. Sam, do you see any other questions? There are several questions about activities and meals and council meetings and things like that. Jocelyn, could you talk again about issues related to coming together and congregate activity meals?
Yeah, I mean, and this is something where I want to be clear. The guidance went here a while ago. The guidance, I think back in March, said that communal dining and communal activities could be happening and should be happening. And we do know that there were many people, many residents who replied to a resident survey that we did at the beginning of the summer that said they were not able to have communal dining and their facilities had no activities. Well, at this point, those things should be happening. The guidance is very clear that, again, as Lori mentioned, everyone needs to continue to adhere to all infection prevention protocols. And they go as far as to say now that if you are in a communal part of the facility, even as a resident, you should have your mask on regardless of your vaccination status. But you know what? That's happening everywhere. My kids at school, they have to wear masks all day. So if a resident goes to participate in an activity, even if they're vaccinated, they should have their masks on when in those communal settings, but those activities can and should be happening. And so if there's a facility where those things are not happening, this is another time to reach out to the ombudsman and talk to them and see what they can do, if they can work with the facility to figure out why these things aren't happening. Because residents, not all residents have visitors. I know so many do, and this has been so hard, but there are residents for whom it's the communal dining and it is those activities that really brings them the connection with other people. And so even if visitation reopens, if those activities aren't happening, there are still a lot of people who are going to feel isolated. So it's very important that facilities follow the guidance and ensure that people can be participating in communal settings right now.
Mm-hmm. And that includes religious activities as well. Someone had posted a question about being able to distribute communion and connect with people on a religious level. Certainly, there need to be accommodations for that to ensure that a resident has access to members of their church that they, or their pastor or their priest or rabbi or whomever they want to engage with on a religious level. And if there were accommodations made previously for making communion available, for example, then the facility should be working to do that, to make that available for people and set up a plan and work with the religious leader and with the residents. I mean, certainly that's something that can be discussed by the resident council and also can be worked with the religious leaders to find a way to accommodate that for people. There have been a number of questions also about ombudsman visits and volunteer ombudsman visits and mask wearing and things like that. Certainly, as ombudsman, you should be coordinating with your state ombudsman about the requirements for your state in terms of your process for going back into the facilities and resuming your ombudsman activities. So please take direction from your state ombudsman with respect to that. And if you're a volunteer ombudsman, be working certainly with the staff ombudsman in your program for direction on how you should be proceeding. Sam, maybe one or two more questions?
Sure. There was a question about getting volunteers back into facilities. Are volunteers allowed back in?
So I actually don't remember seeing anything in the guidance that spoke to that, but at this point, if people want volunteers in the facilities, I can't imagine why they wouldn't be allowed in. I mean, this is now people can have anyone of their choosing inside. Again, when it comes to visitation, that right lies with the resident and not with the person choosing to enter. But I believe facilities can, I don't know if Lori, if there's something I'm missing here, but I do think that volunteers should be able to enter facilities at this point.
Yeah, I mean, I certainly, I think that that's something that should, there should be accommodations made, certainly looking at what the volunteer is intended to do. I don't know if we're talking about an ombudsman volunteer or other types of volunteers, but volunteers are available to do a lot of different things. Some help with activities, for example, or some, provide other supports or assistance to the residents. And as long as they're following protocols and working with if it's a non-ombudsman volunteer, certainly working with the administration on what that process should look like. They should be working that out. If it is an ombudsman volunteer, they should be working with their staff ombudsman and their state ombudsman on what their process and protocols should be. So we will again post the visitation guidance in the chat and our summary in the chat as well. The summary, the guidance, and the recordings will be posted on our website. They will be made available through email also to everyone who's registered for the program. We also, again, would encourage you to sign up for the CMS webinar on the guidance as well. That's taking place next Tuesday. They also, I'm sure, will answer a number of your questions. I think with that, we're coming to a close on today. I know there are a lot of questions, and we're all going to be working through this together. This is not the only opportunity that you'll have to ask questions. We'll do additional work on this and have additional programming where we can work through some of the answers to your questions moving forward as well. Again, I think your best bet at this point is to take the guidance, take the summary with you when you're going. Please keep open communication when you're working with your facilities. Talk with your ombudsman programs and contact them if you're having some issues. Contact your state licensing agency as well. They're supposed to be enforcing the guidance. And we, again, will continue sharing as much information as we get. We know that some of the issues that we're talking about today may need additional clarification. We're hoping that CMS will clarify them. And as we continue to get more information or have opportunity to talk with you all and work on advocacy strategies, we will continue to do that with all of you moving forward. So with that, I'd like to thank Sam and Jocelyn for your work today, for your presentation, and thanks to all of you for joining us. And we will close for today. Happy Thanksgiving to all of you, and we will all share more information soon, and also look forward to hearing back from you about your experiences. So thanks so much. With that, we'll close for the day.